Go.
Hello and welcome back to this edition of Michael's special test for the knee. So the first one we're going to do is the valgus test at both 0 and 30. So this is assessing the MCL. So if there was an MCL tear. So first we are going to extend the leg at 0 degrees and then we're going to apply a valgus force. And what we're looking for is any type of gapping medially, and we're also looking for any pain that the patient may be having. So are you having any pain?
No.
All right. We are then going to go up to 30 degrees of flexion and then also apply that valgus force again and then assess for any more gapping. Any pain with that? No. All right, so the next one we were going to do is the varus force. So with this, we're assessing the LCL integrity. So this one, we're applying a varus force, so that's medially to laterally. And then we're also assessing for any of that gapping that's going on. So if we were having any gapping, then the LCL would be involved. So we're up at 0, and then we go to 30. And apply that varus force. Any pain with that?
No.
All right. So the next is the Lachman's test. So for this one, we want their knee flexed at about 30 to 40 degrees. So what I'm going to do is I'm just going to place their knee on top of my thigh. And then I'm going to stabilize medially with, I guess proximally with my left hand. And then I'm taking my hand where the posterior tibial plateau is, and I'm applying a quick impulse forward. And I'm assessing for any instability through the ACL. So this is an ACL test. So if I noticed that the tibia was translating more anteriorly, I would also compare to the other side to see if there was any incongruencies between the two. The next one is an anterior drawer. So with this one, I'm sitting on the patient's foot. This is kind of awkward as I'm falling off this bed, but we'll go with it anyways. So what I'm doing is I'm taking my fingers and I'm going behind the patient's calf, going back where those tibial plateaus are, and I'm applying a posterior to anterior force forward, also applying for that, or looking for that anterior instability while bringing it forward. So that's also an ACL test. The last one is an axial pivot shift. So with this one, I have the patient's knee flexed at 90 degrees. I'm then assessing for any pop or thud or click. So what I'm doing is I'm internally rotating their leg while also applying a valgus force, and then extending the knee down. And as I extend, if I were to feel a thud or a click, that would be a positive for this test. So that concludes the ACL test. The next test is for the PCL. So with this one, it's called a posterior sag. So with this, if the PCL was involved, the tibia epicondyles would be sagging inferiorly to the femoral condyles. So basically I would just be assessing to see if the tibia was indented down a little bit. So at the joint line, I would assess that. The next one is a posterior drawer, similarly to that of an anterior drawer. So again, I'm sitting on the patient's foot, but instead of pulling out, I'm pushing down. So I'm using my two thumbs. I'm on the tibial tuberosity, and I'm pushing down, assessing for any depression. So I'm also doing that on the non-affected knee too. And then there's 3 different grading for that. So 1 through 5, or like 1 to 5 millimeters is a grade 1, 5 to 10 is a grade 2, and then grade 3 is greater than 10. So that concludes posterior drawer. Now on to meniscus. So the first test is a McMurray's. So with this one, we're assessing both the medial and lateral menisci. So first, if we want to do the medial menisci, I'm having my hand here, so I'm feeling for any pops or thuds, and then I'm going to externally rotate the patient's leg, and then I'm going to extend it down. And as I'm extending it down, I'm feeling to see if there's any pop, thud, or click. So that's for the medial meniscus. And then for the lateral meniscus, hand is laterally, I'm feeling for that click, and then I'm going to internally rotate and extend the patient's leg down. So that is for the meniscus. There's also the aptly, correct? So that is, you have to lay on your stomach for me, please. So with this one, I'm stabilizing the patient's femur by putting my thigh on it as well. And then what I'm doing is I'm distracting up, and then I'm internally and externally rotating the patient's tibia. And then so I do the distraction, and then next I'm going to do the compression. So I'm going to compress the patient's tibia down, and then internally and externally rotate. If it were a positive test, they would have symptom reproduction with the compression and less pain with the distraction. Next, I'm going to have you flip back over onto your back for me. So this test is called the patellar apprehension test. So we're looking at patella dislocation. So with this one, I'm pulling the patella laterally. And as I pull the patella laterally, if the patient were to fire their quad, or they were apprehensive and didn't want me to pull the patella laterally, then that would be a positive test for that. Next is the Clark's, which is a patella,
You do the 30 degrees of passive
flexion.
flexion.
Sorry. Yeah, so when I'm doing for the patella apprehension?
Yes.
Yeah. Okay, so with the patella apprehension, I want to be at 30 degrees passively and then come laterally. And if they have those apprehensive signs, then that would be a positive test.
Good job.
Last, for the patella is the Clark's test. So with this one, I'm applying an inferior force to the patient's superior patella. And then what I'm going to do is ask them to contract their quad muscle for me. And then as they do that, if they have an increase in pain or symptom reproduction, that would be a positive test for the Clark's. The next test is called the Ballottement. So this is assessing for effusion at the kneecap. So what you're doing is you're taking both of your hands together and kind of compressing the tissue together. And then what you're doing is you're taking your index finger and then you're tapping it. And if you feel that the patella is tapping back, you could have some effusion at the kneecap. So that would be a positive test if it rebounds back at you. So that's the Ballottement. Last is the Noble test. So for this one, we're assessing the IT band. So for this one, we're laterally on that IT band. And as we flex from 90 degrees to 0 degrees of extension, the IT band goes from a posterior position to an anterior position as it goes across the epicondyle of the femur. So we're applying pressure to that. Is that painful?
No.
Okay. And then as I come into extension, if I did feel, or if the patient felt that reproduced their pain, then their distal IT band would be involved. So I believe that is all the test for the knee. Thanks for watching.